What I'm going to do now is begin with the med section. Here you're able to see the current meds, pharmacy information, creating a message, or printing a list. And so we're going to jump around some of these areas so you get a better feel for the med portion of it, okay? So here we go. Let me just take a second. And one of the other nice pieces of this is that you're able not only to do that part of it, so we'll go into the med section. You're able to see the medications that you're presently on. And in addition to that, it'll also illustrate the actual, whoever the pharmacy is, and you can pick the pharmacy. Make sure that's the right pharmacy for you, okay? Or you can submit the name of another, let's say you want Target, you can put that in there, we can actually find out. So here are the meds that you're dealing with. And, we often give you information on them. So you may click on this and get access to the actual information on this antibiotic, which is like the PDR, which is the physician desktop that tells us exactly how the drug is used, what side effects are there. And for patients, it's actually a nice piece of information to have. And you're getting an example of what this is it right here. So this is very good to kind of teach you. The pharmacy information, again, is when we click on this part, and that'll be, depending on what we have. The other piece that we're going to show you is the messaging that you want to kind of submit to people. So let's say I want to create a message about, medications that I want, please refill. Refill, just put refill, and then please e-prescribe, or print e-prescribe. Sorry, or fax to my pharmacy, and just send. And that message is going to make it to our staff, and they'll actually send you a follow-up, and we'll keep tracks of all this thing. Allergies is another section that's important, and here you can actually, say, I'm allergic to it, change whatever allergies you've had, and we're implementing all these things to kind of make it work. In terms of the history, this piece will have basically history that you can, submitted history that you may want to put in here, and if there's no change in the history that you're looking at, you'll say no change, and it'll direct so that there's no changes. If for some reason, unfortunately, you may have something that we didn't pick up, this is the perfect place to submit that history. And just by submitting the history, you're able to kind of go through that process. And so, you'll get a summary, you'll say final, and that's basically it for that portion of it. The chart is really interesting because it allows you to access certain data. You'll have a summary of the things that we have in the chart with regards to histories. You'll be able to create a summary from here, or a CCD, or being able to move this information to another provider. Health maintenance report will tell us information with regards to mammograms and PAPs and other tests that we should have on you, and sometimes it's very difficult. You can print some of these for your record, but here you'll be able to go by the things that we're looking. If you're asthmatic, if your HIPAAs are done, whatever other tests you kind of need, at least you're going to be part of the health. And this is just the start of videos that we're kind of putting together so that you'll begin, and there'll be more to come, but this is where we're kind of beginning right now. Thank you very much.